Hello, welcome to Prayer Fertility Clinic. I'm Dr. Erickson. Today we are going to talk about danger signs during pregnancy. So we are talking about 5 danger signs. So please share, subscribe so you can get more of this content. There are 5 danger signs, although there are others, but I decided to mention about these 5 because of the bad outcome you may have if not well addressed. One of these danger signs is bleeding. When women are having vaginal bleeding, it's important for such women to report to the hospital early as possible, especially when the bleeding is still mild in the form of spotting. The reason why such women should report to the hospital is that there are different reasons why a woman might bleed during pregnancy. It can be due to the fact that the placenta, which is the connection between the baby and the mother through the umbilical cord, is separating prematurely. And in such a case, if the woman presents early, the baby can be salvaged, especially if the baby is already mature. Other reason why such bleeding can happen in earlier pregnancy may be due to threatened miscarriage. That means that the pregnancy is threatened, and if some certain measure is not put in place, there may be continuation of that process to the woman losing the pregnancy. So whenever a pregnant woman sees this sign, you should not sit back at home. Please visit the hospital. 2 is when there is fluid trickling down through the private parts, when there is drainage of fluid per vagina. In such cases, it may be due to the fact that the water which protects the baby and the coverage of that water is broken. That's what we call rupture of fetal membrane. And this is not good, because if this seal that prevents infection coming to the baby is broken, what it means that infection can track from the down up to the baby, and when baby inside the womb have such infection, that will call choramnitis. Infection that enters to the womb because baby is tender might lead to the death of the baby. But however, if the woman presents early to the hospital, there are various things that can be done either to salvage or for have a better outcome. So number 3 is when a woman that's pregnant is having these symptoms of hypertension. There are symptoms that dictate that the woman is having severe hypertension. These symptoms that comes are when a woman that is pregnant is having headache, or the woman is having pain at the upper right side of the abdomen, or the woman is having yellowness of the eyes. It may be a pointer that a very bad form of hypertension is present, and this bad form of hypertension is called preeclampsia. The woman should immediately report to hospital if you are experiencing such and get sorted out. Another danger sign that can be experienced during pregnancy is when a woman notices that the baby is not kicking the way it used to kick before. Normally, every woman understands the pattern of kicking of his or her baby. And when there is aberration from the normal, she knows. For a normal fetus, is supposed to be kicking about 10 times in 24 hours. So if a woman has stayed for over 12 hours and have not noticed that the baby is kicking, please report to the hospital. Or if the baby is kicking excessively. The simple analogy to that is that when someone is uncomfortable, you try to move to find a place of safety. Unfortunately for this baby that's inside the womb, he's moving so fast to find a way of exit, but he's being confined within that uterus. In such a situation whereby you notice that your baby is moving excessively, or baby have reduced the way it's moving, please, you should report to the hospital and sought a help from your doctor. Finally, the 5th danger sign is abdominal pain. Abdominal pain is a very such setting something in pregnancy. Sometimes abdominal pain can be normal for a woman that is in labor. Sometimes you may have some mild form of abdominal pain. But such mild form of abdominal pain will allow a woman to engage in her normal daily activities, or shouldn't prevent the woman from sleeping. So if you are pregnant and you're having a pain that is excruciating, that means that the pain is very severe, and the pain does not allow you sleep at night, or you find out that you cannot concentrate with simple tasks or doing your normal daily activities because of this pain. It may be a pointer that there is a problem. There are different things that can cause abdominal pain. It can be due to the fact that the placenta is separated prematurely. That's what we call abruption placenta. It can be due to the fact that there may be lesion on the uterus, such as fibroid, that are degenerating. Sometimes some of these problems might need prompt treatment. And such prompt treatment will help prevent problems that might arise from these symptoms. So, in summary, it is important when you notice some of these danger signs that one should report to the hospital. Aside from these major danger signs, the other signs, when you feel unusual from the way you normally feel, you may sought an advice of a doctor by visiting hospital and get yourself sorted out. If you're having any of these danger signs, symptoms, please do well to visit your doctor to get sorted out. However, if you have any concern or question concerning the topic discussed above, please, you can ask in the comment box and we'll oblige to answer you. Please share, subscribe to our YouTube channel. So see you next time.